This is the Provider Program, your VIP look into what's happening in Tallahassee. FHCA's Provider Program is brought to you by Bouchard Insurance, Medline Industries, and Healthcare Professional Consulting Services. And now, here is your host, Emmett Reed.
All right, welcome to the second edition of the FHCA Provider Program Live. I am the CEO and Executive Director of the Florida Healthcare Association, Emmett Reed, and I am so happy that we have so many of you joining us today. It is just really a fun time. We're going to give an action-packed 30 minutes or less to let you know what's going on in Tallahassee. Since most of you can't come up to Tallahassee this year, we're going to bring Tallahassee to you. And I want to start out today by recognizing that this week is a Long-Term Care Administrators Week. And I want to thank every one of our long-term care administrators out there. You are truly healthcare heroes. You need to be wearing a cape every day to work. What you have done this past year is incredible, and that you've stuck around and that you're still in our profession and still taking care of Florida's frail and elderly means everything. And that's why we do what we do up here in Tallahassee. We take you in our hearts up to the Capitol, knowing what you're doing every day. And we want to have a little surprise and a little fun right now. We're going to put my number up on the screen. And the first caller, you have to be a licensed administrator, the first caller that calls in right now will receive a $50 gift card, compliments of the Florida Healthcare Association. So hopefully my number is going to go up on the screen here in a moment. Oh, wow. I got a call coming in from Vero Beach. Who could it be? Hey, this is Emmett Reed. Who do I have here?
Emmett, it's Edwin.
Edwin, how are you?
Fantastic.
Well, I hope our members can hear you. If you're still calling, stop, because Edwin got in before you. He's going to win. Edwin, how are you doing? Tell me how you've been throughout this past year in the pandemic.
Oh, man, it has been tough. But thank God we've been able to persevere, keep our residents safe. And also thanks to the association for all the insight and guidance that you guys have been providing. It makes a big difference for us here in the field, knowing that you have our backs.
Well, we appreciate you, and it is an absolute honor. I am so happy you called in to win, and we'll be sending you a $50 gift card in recognition of you being the first caller and you just being super awesome as a nursing home administrator. So, Edwin, have a great day, and we're going to continue our show, okay?
Thanks, Emmett.
All right. Bye-bye. Oh, that was so cool. Wow. I feel almost like a real talk show host after that. That was really nice. I hope you all could hear Edwin out there. I know he's been a long time supporter, board member, and always willing to help here at the Capitol whenever we need him. Today's program, we're going to be talking about obviously the COVID-19 liability protections. We started something called virtual lobby days this year. They're not as fun as in-person lobby days, but we're hearing they're kind of effective, and we want to talk about that as well and hear from our members and legislatures and one of our sponsors, Medline Industries. And then we're also going to talk about other bills that might be impacting the long-term care space. So I'd like to thank our sponsors right now, Bouchard Insurance, Medline, of course, Industries, and the Healthcare Professional Consulting Services. We are so grateful for their help and their sponsorship. We wouldn't be able to bring this show to you without their sponsorship. So thanks to the sponsors. If they give you a call, please listen to them. I also want to remind you that we have a Q&A chat function on the website. You can ask us questions throughout the show and we'll take them live. So as we go throughout the show, we will be glad to answer any questions that you have. So now I've got on the set with me Toby Philpott, our chief lobbyist. Toby, week 2, you're still here. That's a good sign.
I'm having a blast.
Living the dream, right?
Living the dream.
That's right. So Toby, we want to talk about COVID liability. Obviously, that's been the hot topic. It's been in the papers. It's been talked about all throughout Tallahassee. Where are we at with COVID liability?
Well, Emmett, both the House and Senate healthcare liability bills reached their last committee stops. They were each referenced to 3 committees. In the House, the last committee stop for the healthcare liability bill was the House Judiciary Committee. It passed favorably out of the Judiciary Committee 15-5, so it will be headed to the House floor. And then yesterday, the Senate Rules Committee took up the healthcare liability bill, and they amended the healthcare liability protections onto the Senate business liability bill. So we now have one bill in the Senate that covers not only the business entities and interests, but also our healthcare providers, our long-term care facilities.
Why is that important, one bill?
It's an incredibly smart strategic move because it combines it in one bill. And so now you have every entity, every sector of Florida's economy is protected in one bill. And from the perspective of strategy, when you had 2 bills, you may have another chamber that could hold the healthcare bill hostage and pass just the business bill, and then the healthcare bill doesn't get passed. And with this now combined with all the sectors of Florida's economy, the potential for passing is great. It also forces stakeholders and different interest groups to really work together to get something passed.
So you're saying we're in the same bill that Disney's in?
Absolutely, and Publix.
And Publix, so that's good company.
I think so. I think we're really well positioned coming out of the 3rd committee stop. And I will tell you that Senate President Simpson, in his remarks at a press conference yesterday, certainly gave his full-throated endorsement to these liability protections. He believes that the Senate bill that is now combined could be heard as early as next week on the Senate floor. And he's hopeful that we may have a final product ready for the governor's signature perhaps in 2 weeks. So I think things are moving along. We still got a lot of time on the clock, and we're going to be vigilant and make sure that we secure those protections for our nursing homes and assisted living facilities.
Now that's a great update. We're talking about rock stars and great administrators and unbelievable members. Yesterday, Joanne Watson from Miracle Hill testified. How'd she do?
She was absolutely phenomenal. And I will tell you that she and Senator Brandes, who's been a true champion, both gave great remarks at the committee. And I think we may have a clip of that. So,
okay.
The nursing homes didn't create this virus. They were struggling to find PPE for months in these nursing homes. PPE was a shower cap, a homemade mask, and a trash bag. The best test that we had was a thermometer, which I think we can all agree is a very crude tool for a COVID test. But that's what they had. And then we put standards on them, and we asked them to do certain things, and we asked them to lock down their residents, but we told them they had to maintain staffing levels, and we told them that they had to continue to care for residents. And to my knowledge, not one nursing home in the state of Florida pushed their residents to the curb and said, we can no longer keep you safe. We can no longer take care of you. They powered through this, and they struggled through it. We asked them to MacGyver their way through a global pandemic. And they were there, and they did the best they could for the residents they had. They were there for our family members on the front end of this. We've got to be there for them, for them on the back end of this. So I would ask you both to slow me down.
We've had extreme difficulty in retaining staff. The staff are either getting sick from COVID, they're leaving the industry altogether, they're just emotionally drained, physically drained, and the competition of being able to even meet the financial obligation to afford the staff and the challenges of our staffing agency competitors. It's unreal. It's simply beyond my imagination that anything I could have ever imagined to combat during COVID. Our liability insurance went from 0 deductible to $75,000 deductible. The cost to retain staff and the cost to provide PPE and the cost to just make sure that all the technology is in place to protect our residents from COVID and from infection to maintain infection control is astronomical. And we just have to pour all of our resources into taking care of your loved ones. We have to. There's no other sensible option. All of our resources need to be spent on the organization thriving and on keeping our residents in Florida safe and not on lawsuits.
All right. Wow. That was very compelling. We really hope you enjoyed that video. Now, Toby, I know we had a question in the chat box about bill numbers, and then let's talk next stops for the bill.
Absolutely, Emmett. The new Senate bill number is 72. So the healthcare protections were amended onto the Senate business bill. So look out for Senate Bill 72 as that's heard on the Senate floor next week. And we anticipate that the House Healthcare Bill 7005 will be heard on the House floor next week as well. And I do want to thank Ms. Joanne Watson for her time yesterday. It's incredibly important. We know our most powerful voices are members' voices. And so I want to thank her, and certainly Senator Brandes, who's been a true champion on liability.
Excellent. Well, we certainly know that it's not over until it's over with COVID liability, but it certainly is moving rapidly. So keep an eye on it, and we'll keep you posted throughout the week, next week, with all the ways we have to communicate with you. Now let's take a moment to hear from our sponsors, and we'll be right back after this break.
It was the year of the nurse, they said, in 2020, and let that resonate, you know, going forward, you know, from Nightingale responding to the Crimean War, you know, when she became Nightingale and wrote the practices that we do today. Are you going to blame her for what happened then, that kind of thing? And it's the same way now. It's like we're responding to our Crimean War of our time, of our century, and nurses are rising to the occasion. The nursing field, the nursing industry is rising to the occasion. And it's like, be mindful, be respectful of that, be knowledgeable of that. That is not just all about, like, we're here, we have the same vision. We have the same vision. And when you're supporting something, support the people who are making it matter, on the front lines and at the bedside. Places like us that are doing a good job, like, we need to be protected.
FHCA's Provider Program is brought to you by Bouchard Insurance, offering exclusive insurance programs for FHCA members. Medline Industries, the leading post-acute medical supplier with solutions to lower readmissions, improve customer satisfaction, and help improve survey outcomes. And Healthcare Professional Consulting Services, delivering premier business and financial consulting in areas like revenue cycle management and compliance guidelines for Florida's long-term care communities.
All right, welcome back. You know, normally we talked about the virtual Lobby Wednesdays. Normally we would have you up here in our Education and Training Center in Tallahassee. We'd have our members charging the Capitol, and we can't wait till we can do that again. However, this year we have pivoted to the virtual Lobby Wednesdays, and all of our Lobby Wednesdays, whether it's virtual or in person, Medline Industries has been a leader in sponsoring those days. They've always been up here helping charge the hill with us, and they've also were a 2020 pledge partner for the association, which meant that we didn't know what 2020 was going to bring as far as sponsorship opportunities were involved, but Medline said it didn't matter to us. We're going to continue our commitment, financial commitment to the association, because that's how much we believe in you. So we certainly appreciate Medline for doing that. And we were able to catch up with David Lilly earlier in the week to talk to him a little bit about certain conversations that he wanted to have with us. So let's hear from David.
I think it's so important to support FHCA's legislative initiatives for a variety of reasons. Number one, they are looking out for the best interests of the providers and the people that provide care to our most vulnerable citizens. So during the pandemic and continuing, Medline is supporting the providers in a variety of ways. First and foremost, as the PPE demand skyrocketed globally, we started air freighting product in. We converted some factories in the U.S. to make massive amounts of hand sanitizer. We actually started domestically producing face masks. And then also our clinical services team helped develop protocols and best practices for infection prevention and getting that out to our customers and anybody in the industry, really, to learn about ways to improve practices to limit contact from caregivers in wound care, for instance, but also just infection prevention practices throughout the facility. So, trying to get as much product available to our people, trying to find ways to be more efficient, and then also just delivering clear messaging about the reality of what's available, what's not, so the providers can, make adjustments. And we just wanted to be available and open access and total transparency. Medline is so proud and honored to be part of FHCA, to be able to be a sponsor, but also to help, learn from providers and help give, our expertise and, resources to help people during COVID and beyond. We're just so proud to be associated with the great work that Florida Healthcare Association does, and to be connected to such great caregivers and providers who have really shown what they're made of during this crisis. So we're proud to be a part of it. In any way we can help, we are happy to do it.
All right. It is always great to hear from the folks at Medline. Thank you so much. Welcome back, everybody. Emmett Reed and Toby Philpott here. As I told you earlier, we have moved now from the actual in-person Lobby Wednesdays to a virtual Lobby Wednesday. And Toby, I want to hear how that's going. Let everyone know.
Yeah, Emmett, as you said, we're working every day to create meaningful interactions between our members and members of the Florida legislature. That's obviously a unique challenge this year with the Capitol closed and we're having to do virtually. But this week we started our virtual legislator meetings, and I could not be more excited. We probably had 10 Zoom meetings with legislators from across South Florida and a number of our members talking on all of our issues, not just liability protection, certainly our PCA program, which has been incredibly well received by a number of facilities, but reimbursement and the budget. And I want to thank all our friends in South Florida who participated this week, especially Representative Elaine Bloom. It was incredibly helpful to connect with these members in this virtual environment. And I will tell you, as we move forward, Melody Arnold on our team is scheduling these meetings where we've divided the state into geographic regions. And so we're trying to connect our member facilities with their locally elected and regionally elected members, as well as key committee members that our bills will be heard for. And so in the coming weeks, as we look to other areas of the state, you'll be contacted by Melody. And I just welcome our most powerful voices, you, our members. And I hope that everyone will take an opportunity to participate. I know we have a short clip from one of our first virtual meetings this week. And I think we've got it here teed up for everybody to see.
I don't think most people know it, but actually nursing homes are regulated with even more strictness than hospitals. And we get called on the carpet almost daily for somebody who has a complaint. And fortunately for almost all of us, the complaints are found unsubstantiated. So there are always people who just look to make cases. And most of the cases turn out to cost us $5,000 or $10,000 just to get rid of them. But I think you're very well aware of the fact that there's a cottage industry, a lot of law firms that make their money on urging people to file lawsuits.
Sure. And I'm on the other side of that. So we're all on the same page there. And I support the COVID liability issues and the limiting litigation through the pandemic. So there's no issue there.
If our revenue goes away, we're going to be further in the hole. You're going to see closures of facilities. I mean, there's no way to continue it long-term at a deficit like this if we don't get, the CARES money is great, but it's going to stop at some point, I'm assuming. And we need to keep our actual funding, which keeps us going on our day-to-day basis.
I believe in what you need it for, definitely. It's so important that, that you all remain viable.
Staffing is been tough, not only across the state of Florida, but the nation, the world probably, because it's a worldwide crisis. But here in the Florida Keys, we've had our challenges with getting staff to operate our nursing home. The workforce challenges have been incredible down here. We're using agency staffing, an additional $30,000 a month just to with nurses and CNAs. CNAs are costing upwards to $42, $45 an hour through agency, and of course nurses are much higher. We're using the personal care attendant program. I'd like to encourage you to vote to make that permanent for us. That's a program that is working. We're training CNAs. local people that are looking for work that maybe were affected in another industry that maybe want to get into healthcare. And so that has been helping us some, but it has been challenging.
I'm familiar with the bill, and I think it's a great bill. And Senator Bean, I'm sure you heard he has COVID, so I've been covering for him, chairing the HHS Appropriations Committee. We just had a meeting this afternoon, and so I have, I will do everything in my power to help move that bill along as much as possible.
When I hear conversations of, oh, well, nursing facilities got CARES Act money and they should be doing great. And it's like, the reality is those dollars that we received have been spent already. And we absolutely must have the funding to support us to be able to continue to provide the quality of care that we have been known to do.
Thank you all for everything that you have said. It resonates with me, and I certainly will keep all of your feedback in mind as we move through the budgeting process and continue moving forward.
All right, welcome back. Boy, that was awesome. And we just want to remind everybody, if you're interested in participating in a virtual lobby Wednesday, then please contact Toby or Melody, Tom, Annette, anyone on our government affairs team will be happy to make that happen for you. And it really does make a difference when you frontline caregivers are the ones delivering the message. We can only do so much. We have to have member involvement. All right, so right now we want to talk to Toby about some other bills that may affect the long-term care space and where they're tracking, what's happening.
Emmett, we're monitoring a number of bills that could impact our providers, everything from fire safety and fire sprinklers to larger agency bills. One of the bills that we've been workshopping with Matt Thompson, the chair of our FHCA legislative committee, and our legislative committee members is the dementia-related training bill that's sponsored by Audrey Gibson in the Senate and Cord Byrd in the House. And that really just seeks to bring some uniformity to the training requirements for Alzheimer's disease and related disorders. It would require, initial 1 hour training and then 3 additional hours of training within the first 4 months of a new employee. And it would also require annual training of 4 hours. And I will tell you that we're certainly wanting to support good public policy, but we also don't want to increase regulatory demands on our providers. And we know what this year has been like, how this pandemic has challenged the staffing model and our staff and that turnover. So on that bill particularly, we're working with the sponsors to try to get a greater degree of flexibility in terms of the timeframes that they have in the bill for training, and also looking at some other amendments so that we make sure that we have maximum flexibility for our operators and administrators on the front lines, while also recognizing the need to make sure everybody's trained on this Alzheimer's and other disorders. I will tell you a second bill that we're looking at is Senate Bill 1803. It's a medication technician bill. And so that bill would allow an unlicensed staff member that's got 6 hours of training to help a resident with self-administered medication. It also puts a training program online and coursework. And it would also seek to direct Medicaid health plans to pay ALFs based on resident acuity and their medical complexity. And so that was introduced this week. It's been referenced to committees. And so we're following a range of legislation that affects not only our nursing homes, but our ALFs. And so that medication technician bill is something that's on our radar, and we'll continue to follow it.
Okay, very interesting. Now, also CMS, our friends at CMS, surprising, came out with an announcement on visitation.
As you know, nothing replaces that resident and family interaction and engagement. And I want to thank all our colleagues and friends out there who really have filled the void, have been the family for so many of our residents over the past year. And I thank you. And certainly this new CDC and CMS guidance is positive. It spells out that visitation should be allowed indoors. There are certain parameters on it in terms of looking at a county positivity rate, as well as the number of residents that have been vaccinated. But it also speaks to compassionate care visits, and that those should be allowed regardless of the positivity rate in the county or the vaccination status of a resident or visitor. And so we've put it side by side together on the website. I would encourage everyone to look through that. We're certainly mindful that there may be some issues as it relates to the state executive order, and we're working through that and seeking clarifications with the Agency for Healthcare Administration. But I think if you look at the side-by-side on the website, it'll bring greater clarity to what CMS and CDC released this week, which was positive.
Awesome. So don't forget to check out FHCA.org for that information. We're going to take a quick commercial break, and then we're going to wrap it up with some exciting news.
Make plans to join Florida Healthcare Association this summer in St. Pete Beach for our annual Nurse Leadership Program, set for June 2nd through 4th at the fabulous Don Cesar Hotel. We all know we're better together, and we're excited to gather safely in person for what has become known as the leading clinical conference in Florida. Administrators, nurses, and other clinical leaders will enjoy our educational sessions and networking opportunities, along with our extended tabletop expo and award recognitions. Registration and room block are open. Visit the FHCA website today to learn more about this premier program and reserve your seat today.
I was working for a moving company, but I went on maternity leave because I just had my baby girl in June. And I heard about this program, and so I applied, and I didn't go back to the moving company because I want to better myself as a mom. Definitely get into this career, and you can always move up, starting out as a PCA, becoming a CNA, and then it depends on you as a person if you want to further yourself. But everything is there for you. All you have to do is ask.
All right, welcome back. It's Emmett Reed and Toby Philpott here from the education, and actually from like the 40th floor of the Capitol, but from the Education and Training Center here in Tallahassee, wrapping up our second edition of the FHCA Provider Program Live. Toby, touch on the PCA bill. I know we've got that outstanding as well.
Yeah, I think we're excited. I think we're poised to see the personal care attendant bill on the agenda in both the Senate and the House this next week. We're optimistic to get that moving. We received the endorsement of the Florida Directors of Nursing Home Administrators, and it's a bipartisan bill. We've got Democrats as well as Republicans supporting this bill, so we've got a lot of energy behind it. We just need to get it on the agenda and heard, and I think we'll keep it moving. So.
All right, well, that's great. Listen, that was a lot of information in a little amount of time. I hope you enjoyed the show. I want to give a shout out to our president, Marco Carrasco, and the entire FHCA Executive Committee and Board as they're continuing to have constant Zoom calls and meetings. We've got a virtual board meeting next week. It's our last virtual board meeting, and then in May, we're actually going to be in person, so we cannot wait to see you all. And I know Marco is going to be a special guest on the show, and we're going to have some other surprise interviews with members coming up. Now we've got our feet under us a little bit with the show. So once again, thank you to our sponsors, Bouchard Insurance, Medline, and Healthcare Professional Consulting Services Incorporated. I want to thank you all for what you do. Thanks for joining us, and we'll see you next Friday.